How common is genital herpes?
Very, very common. Genital herpes is one of the most, because it's so, it stays with you forever. It's a very prevalent disease. Now the incidence is not as high as it used to be, but it's definitely a very common disease.
Now you've used this word a few times, that it's forever. And we live in a society where people are always looking at different maladies, different afflictions, and there's always the look for a cure. Are we any closer to a cure for genital herpes? Is it even medically possible to cure this?
Well, very unlikely that we have a cure for genital herpes at this moment, because we know that this disease will stay within your system forever. It's part of your immune system is going to have this. So the treatment is really to prevent outbreaks of the disease, but there's not any way, shape, or form to have a cure of it. Now, the good thing about herpes is that most likely, unless you're immunocompromised, you're not going to die from a herpes infection. But the herpes infections are very annoying, and they're irritating and all that, but it's not going to cause, unless your immune system is affected, it's not going to cause you severe damage to your system.
For women who suffer from genital herpes and they then get pregnant, is it automatically passed on to the child? No.
The majority of, the highest risk for infection to pass from mom to children is a primary infection, meaning you never had genital herpes and you got pregnant with herpes, got pregnant, and then pregnancy you develop a primary herpes infection, you have a higher chance of the baby to get a herpes. But once you have an infection and what you have is a recurrence of this infection, it's less likely that this is going to affect the pregnancy. Even a primary infection, the risk is very low. Now, the important thing with herpes is that, and a lot of times patients forget to tell the doctors they have a history of herpes infection. Why is that important? Because in the third trimester, close to delivery, you should be treated prophylactic to prevent outbreaks, reducing the chances of you develop the infection. The higher chance of the baby to catch the infection is if you have active lesions and the baby's coming out through the birth canal. So in those cases, a C-section is recommended.